Good afternoon and welcome. Thank you for joining us today for a webinar on how HHS Testing and Diagnostics Working Group is increasing community access to testing in schools. You may hear this program referred to in its acronym form as ICATT in schools. This webinar will be recorded for future access as a reference for more information. If you have questions throughout the webinar, please submit them in the Q&A box at the bottom of your screen, and we'll answer them during the Q&A portion of the program. Slide. I would like to introduce our panelists today, starting with CDC's Joe Miller, currently deployed to the U.S. Department of Health and Human Services Testing and Diagnostics Working Group. Joe is the lead for the ICATT program. I'm Melissa Carter, also a CDC employee deployed to HHS and serving as program manager for ICATT. Next, we are joined by CDC's Jessica Gross, who leads the K-12 testing team out of School Fieldwork section of the CDC State, Tribal, Local, and Territorial Task Force. Also joining us today is CDC's Angelica O'Connor, who will be presenting on reopening schools with the Epidemiology and Laboratory Capacity, or ELC program. And finally, we are pleased to welcome Eliza Novick, Project Manager for the Shaw Foundation, who will share more on the Shaw Family Foundation's online resources and logistical support tools as used during an example rollout of school testing initiatives in Massachusetts. Examples like these can help schools implement ICATT opportunities. I'm happy to welcome both our attendees and panelists to today's webinar. The webinar will include 30 minutes of presentation content and a 15-minute live Q&A session. We'll begin our presentations with Joe providing an ICATT program overview, including ICATT objectives, roles, and responsibilities, school district selection criteria, process timeline, and future next steps. Then we'll turn to Jessica and Angelica to discuss coordination with CDC health liaisons and ELC, and then to Eliza on collaboration with the Shaw Family Foundation. At the end of these presentations, we'll begin our live Q&A session. So please remember to submit your questions to the Q&A box. Joe, we look to you first for an overview on ICATT and its distinction from Operation ET, another school program with HHS Testing and Diagnostics Working Group.
Okay, thank you so much. Next slide, please. So there are multiple programs the US government is supporting to help schools reopen and remain open. Today's focus is on the ICATT program. So this is the Increasing Community Access to Testing in Schools program. The ELC representative will provide more detail on their program and the timeline towards the end of this presentation. And Operation ET Hub Initiative is currently in the process of selecting contractors for their program, and they will be providing more detailed information on their program in the future. The ICATT program is distinct from both ELC and ET programs in that it's intended to be a near-term solution for school testing. We have experienced contractors that are available now to provide testing resources to schools. Also, the ICATT program is focused on vulnerable communities and schools that require additional assistance to set up testing programs and strategies. Finally, it's envisioned that this resource can be used as a testing ground for school systems or schools to further develop their program strategy to start testing for their programs testing or for the program strategy prior to starting their ELC or ET hub testing program. Next slide, please. So ICATT has contracted with pharmacies that are ready to support school testing. These contractors have tested over 10 million samples to date, and they make up close to 5% of all the testing that's currently being performed and reported in the country. So these contractors are what we like to call war tested. Their services include sample collection, sample transport, sample processing, and results reporting, according to the CARES Act. We will reach out to each state, Washington, D.C., and Puerto Rico to offer testing services. And we're currently investigating whether other Caribbean islands or Pacific islands are in scope of our contract. So there'll be more to come on that. I know we've received that question earlier. And again, the goal of the ICATT program is to provide immediate full service testing support to underserved schools and to support their transition to more sustainable school testing solutions. Next slide, please. Responsibility for implementing ICATT testing resources will be divided across members of the ICATT team. So contracts, governments, and school districts will all have a role to play. But this program is designed so that the majority of the burden for implementing a testing program falls on the ICATT team and ICATT contractors and not on the local school. The ICATT team has worked with contractors to develop detailed playbooks for different testing models and a standard process for implementing those testing resources on the ground and into a school. And we anticipate that that would take about 2 to 3 weeks once the process is started. Describing the program at a high level, states will recommend schools, districts. They will then be selected by the ICATT program. Additional programmatic and strategic support for schools will be available from the Shaw Family Foundation, Rockefeller Foundation, CDC, and state and local governments. Contractors will work directly then with school districts to coordinate the logistics of implementing testing. And the ICATT team will then, as part of this entire process, be facilitating and monitoring the progress of testing. Next slide, please. Realizing that one size might not fit all when considering school testing, we intend to provide unique testing solutions for each school and or district as much as possible. The ICATT testing will begin with individual PCR testing and point of care options. We'll work with school districts to understand then if pooling, at-home collection, or other models make sense for that location. And we'll work with our contractors to quickly implement these models as needed. Each contractor provides a slightly different offering. So the ICATT team will be pairing contractors and districts based on priorities and their geographic location and best fit of services to needs. We've tried to make this resource as turnkey as possible, but there's some processes that will remain the responsibility of the schools. And this will include communications with the school community, collection of consent forms, and development of the testing strategy. Later in the presentation, Jessica and Eliza will describe some of the unique resources that are available to schools to make this as painless and easy as possible. Next slide, please. Again, ICATT will be targeting school districts that are in socially vulnerable communities with a high vulnerability to COVID-19. This slide describes some of the criteria that we'll be using to evaluate participation in the program. Criteria 1, 2, and 3 are quantitative measures, while 4 is more of a qualitative measure. We will prioritize schools that are capable of actioning immediately to implement testing. Thus, for number 4, a statement demonstrating readiness in your application will be sufficient for that criteria. These criteria are an important guide for state health departments and school districts to consider when selecting schools for the ICATT program, and more detailed information about this criteria and the application process will follow after the call. Next slide, please. In terms of next steps, we're asking state health departments in coordination with their departments of education to recommend up to 3 school districts per state. So to provide a little more detail on the process, and again, additional detail will follow from this call. But at a high level, we envision that the CDC STLT support task force health liaisons will contact each of their Department of Health points of contact, and they will receive links and lookup tables for each of the criteria so that they, in combination with their departments of education, can together identify schools or school districts for participation that meet the aforementioned criteria. Once a group of schools or a school system is selected, information can be returned to the ICATT program using a standard data collection form or letter. Again, after this call, either today or tomorrow, the State Department of Health will receive an email from their STLT support task force liaison describing the opt-in process in more detail. We intend to prioritize socially and pandemically vulnerable schools that are both ready and willing to begin ICATT discussions immediately. And we will share additional information again following this presentation. Next slide, please. We have a fairly aggressive timeline for implementation, but because we have a lot of confidence in our testing contractors, we are confident that we can follow this timeline with the support of all of our partners and the willingness of the state, our state partners and local school districts. We're requesting letters of support to be, after this, this webinar, to be returned by April 21st. And then we intend to identify partners for participation a week later, and potentially on a rolling basis too, because we want to make sure that we envision that some states may not participate. And so there might be additional resources available after the initial selection process. So the last 3 time points will be rolling. However, at each of these stages, we'll make sure that we notify all of the participants of the status of their application. And with that, I'm going to hand it back over to Melissa. Thank you very much.
Thank you, Joe. And let's turn to Jessica and Angelica now to provide an overview of some of the support CDC can provide to states in implementing and evaluating programs, as well as some context for ELC awards.
Great, thanks, Melissa. Next slide, please. So following this webinar, CDC's Health Department LNOs will share ICATT letters with their state health departments, as Joe mentioned earlier, and they're being asked to work closely with their state and local departments of education to identify priority districts, again, according to the criteria that Joe mentioned. So when state health departments submit their priority districts back to ICATT, We ask that they either CC their HD LNOs, or if it's through an electronic submission, then that they would notify their HD LNOs of the priority districts shared with ICATT. And again, this is just to enhance the coordination between CDC and HHS. Next slide. So CDC will support process evaluations for 2 to 3 pilot districts to inform testing models and better understand factors that could either increase participation in school screening testing programs, that could decrease interruption to educational time, decrease the workload to school district staff, or build local school health capacity, increase comfort with in-person learning, or better target these programs to meet community needs. And so again, we'll look specifically at 2 to 3 pilots, and then the tools that are developed could certainly be shared and utilized by other groups piloting programs in their districts. Next slide. So jurisdictions can consider ways to leverage their participation in the ICATT program to inform their ELC school testing program design. So for example, using pilot programs, one to redesign, modify, rethink, reshape an existing model that you already have up and running. This may be an opportunity to think through how that could be modified in some way. If your jurisdiction is yet to do much school-related testing to date, ICATT may be an opportunity to try out 1 or 2 models that you could then scale with ELC funds. ICATT also offers an opportunity of additional support. They have a full service model, and so there may be specific districts that are facing more challenges where ICATT could provide the support needed to really get a testing program up and running. Additionally, as Joe mentioned, it's fully funded, and so it may be an opportunity to conserve funds in one area and utilize ICATT funding in this interim period. These pilots also offer the opportunity, to evaluate a new model and see if this model may be more cost effective for scalability, again, with ILC funds. So at this point, I'll pass it over to Angelica. Thanks.
Thanks, Jessica. Absolutely. So today, the ELC has awarded approximately $40 billion in COVID dollars to support jurisdictions with their COVID response efforts. The most recent of which is the $10 billion that we've been kind of referencing so far for K-12 school testing. The funds are exclusively aimed at supporting COVID-19 screening testing for teachers, staff, and students, and to assist schools in reopening safely for in-person instruction. Unlike some of the other efforts supporting testing in schools that are being discussed, these resources are they've been provided to all of our ELC recipients, all 64, who happen to be health departments. And the funding levels were determined by population. 85% of this $10 billion is expected to be allocated to support the school districts. So that can be either directly, like with mini grants to schools, or indirectly, like if a state were to manage a cooperative agreement, or I'm sorry, a contract for testing on behalf of the school, for example. Awards were actually made last week on the 9th, and the recipients are encouraged to start spending right now and getting the resources to the districts immediately. Some schools are out for the rest of the summer pretty soon, and others are really going to be also managing summer camps. So bringing on testing in schools isn't going to be one size fits all. Of course, we've been talking about that. Some jurisdictions are already doing a great job implementing this. We expect that our recipients will employ a variety of ways to address screening in schools moving forward. And while not required, one such method might be the ICATT model. And we would want to make sure that if you've had success with the ICATT, that you connect with your health department to make sure that you can continue and expand on those efforts. And so if you have questions about the ELC within your jurisdiction, the best point of contact is going to be your ELC project director. And if you have any questions about the ELC program at CDC, you can email elc@cdc.gov. With that, I'll turn it back to Melissa.
Thank you, Jessica and Angelica. Next, I'll pass it to Eliza from the Shaw Family Foundation. She'll be describing some of the resources the Shaw Family Foundation provides to help schools and school districts in implementing ICATT.
Hi, good afternoon. I'm Eliza with the Shaw Foundation. We're a small foundation based in Boston, Massachusetts, and we've been working closely with Massachusetts schools and the Commonwealth to support COVID testing across the state here. So we're very excited to be looking at a national model. So we've been working on the openandsafeschools.org online toolkit. And this is aligned to help schools participating in ICATT programs. And then as testing in schools goes nationwide, the site and toolkit will grow with the programming funding. So we got involved in this work because we knew that it was really important to have operational guides and how-tos and examples to help schools interpret and use policy that came from the state and the federal government. And naming why these toolkits have been important and useful. To begin with, testing programs can be daunting. They can be logistically complicated. And some of the misconceptions and confusion around policies and vendors and types of tests can prevent schools from signing up. We also heard that schools are struggling to explain testing programs to their families, to their staff, and needed pointers in order to increase participation in their programs. And finally, our work in Massachusetts, we saw that district and state leaders wanted navigation tools to help choose vendors, partners, and set schools up for success. And next slide, please. So with that in mind, these online toolkits provide what we think of as a one-stop shop to support districts' testing programs. We know there's an enormous amount of federal funding coming into states and local governments, like my colleagues mentioned. So using the online toolkit, we can give school leaders, families, operating teams the tools they need to have access to relevant information on tests, vendors, operations, and maintenance of their programs after they've gone live. So openandsafeschools.org is this one-stop shop where the online toolkit will live. I'm sure you're all clamoring to visit openandsafeschools.org while I'm speaking. It is in the final stages of being tweaked, so please come back tomorrow for a live version. I'm sure you'll all book your calendars to wrap up your week with a visit to openandsafeschools.org. But the goal of the website is to break down this kind of overwhelming process into bite-sized pieces so folks can easily find what they need. An example of a diagram that we have on our website is on the right. Really simple, visual, accessible is the name of the game. Next slide, please. So as I mentioned, the online toolkit is based on our work in Massachusetts. This is a live site if you want to check it out now. It's tailored to the program in Massachusetts that we've been working with DESE. It has a whole bunch of resources on it. For example, we go into a lot of detail around why COVID testing in schools is important, how to get started, vendor information, communications templates, tons of examples, a networking hub where schools can connect with other school leaders. So nurses can find nurses who are going through the same thing they are. For example, and we have a whole bunch of FAQs. So on the next pages, I have a couple of examples of what these materials look like that very shortly you will be able to find on openandsafeschools.org as well. Next page, please. So we're broken into three main sections. This first one is why to test. And we think of this as kind of COVID-19 testing 101 for schools. We have videos of what testing looks like in schools. We have a lot of information explaining why testing helps keep schools open and keep kids and students and staff rather in the classroom safely. We know that for some folks that's a given, but it's not necessarily an obvious answer. So we want to make kind of explanations that school leaders can cut and paste into their own communications with their communities. We have definitions, kind of a library of terms, deciphering different kinds of COVID tests, really great kind of basics resource for communities. Next page, please. The next part of our website is all about getting started. And this is really tactical and where we'll be pointing districts participating in ICATT or any other school districts that are getting started with COVID testing, we're going to point them here. So this includes step-by-step checklists, like, what to do in what order, some recommendations around process, different roles that you might expect people in your school community to play to support the testing, how to collect consent, operational guides. And this is really the kind of how to get off the ground and get your hands dirty with testing. All these documents are kind of improved on a rolling basis with feedback from the field. So we're very excited to make this as useful as possible for school communities and make it plug and play so that leaders and vendors as well can download what they need and deliver it directly to their testing teams. Next page, please. And the last piece of the website is all around communications. So we hear a lot from school leaders that they're looking for help communicating about school testing, or excuse me, about COVID testing to their communities. And this could be to school boards, to parents, staff members, students. Maybe it's the general public in their community and they need to explain why they're doing this program. In this section, we have a three-phase communication plan that's sort of a calendar with different checkpoints that a district can use. We have key messages that school leaders can copy and paste from. We have an example template of a dashboard if they want to create their own website and post results of their testing program. And then finally, we have tons of examples from a whole bunch of districts. And this is a constantly growing list. And we hear time and time again that districts really like seeing examples of what other schools have done. And we have a whole library that's accessible. So as I mentioned, the website will be going live tomorrow. Please check it out. And we hope this is as useful as possible for your communities. Thank you.
Thank you, Eliza. So this concludes the formal presentations for today. I want to say thank you to all our panelists for sharing their important work in this ICATT webinar. For the remaining time, we're going to move on to the Q&A portion of the presentation. Okay, looks like we have several questions. So thank you all for submitting your questions to the ICATT team so we can start making sure to provide better understanding of the school testing program and other programs that will complement ICATT. We'll do our best to answer the many questions that have been submitted for the webinar, and we'll monitor the current Q&A submission box for additional questions. So keep submitting those based on our presentation today. We're going to start off by answering a few questions on the overall objectives and scope for the ICATT program. So Joe, this first question goes to you. And the question is, what is the purpose of the ICATT program and who benefits?
Thanks, Melissa. So the national strategy for the COVID response and pandemic preparedness, it calls for maximizing accessibility to free testing, so especially among underserved populations. So in that in the spirit of that strategy, ICATT provides testing services to schools that are located in underserved or socially vulnerable communities. And we're leveraging our private partnerships that we have with testing contractors to provide additional support for these communities to ensure that they receive resources to implement testing within their schools in a way that's equitable compared to other communities that might be less vulnerable.
Okay, thanks, Joe. The second question is also for you. With the Biden administration's announcement on March 17th, stating that $10 billion in funding would be provided specifically for school screenings to help reopen schools and help them remain open, How does this parallel the previously announced testing expansion activities published in February?
Okay, it sounds like a little bit of a loaded question. So let's see. So funding for expanding COVID-19 testing capacity across the country. So this is part of the national testing strategy under the Biden administration. So ICATT and Operation ET are two HHS testing programs that are part of that come out of the Testing and Diagnostic Working Group, and that's to coordinate testing in schools and help increase testing throughout the U.S. and increase access to testing throughout the U.S. in a way that's free, and also focuses on underserved communities or underserved schools. The $10 billion funding announced by HHS through the ELC program and as part of the American Rescue Program, that's intended to complement the ICATT and Operation ET testing initiatives. And that allows public health departments to support schools and strengthen COVID screening testing to reopen schools and keep them open. All of these measures are part of the President Biden's administration strategy to increase testing nationwide that's concurrent with the increase in vaccinations to ensure that we don't have, so that once cases decline, we can ensure that we don't have another wave as a result.
Thank you,
Over.
Joe.
Yeah.
Let's turn now to a few questions about ICATT school testing offerings. So Jessica, this first question is for you. What % of students are tested, on what days, and what if students are in person only twice a week?
Sure. So, ICATT's really looking to motivate testing. Very few programs have actually mandated screening testing in schools to date. It was more common in the fall in private schools and independent school settings. But ICATT's really looking to allow districts to design programming that works for them. And that would include, the testing schedules as well. And so the contractors that ICATT has will work very closely with schools and school districts to make sure that they essentially have a mutually agreeable plan and program, that is least disruptive to the educational schedule. And so, from prior pilots, there were districts that used PCR tests on everyone once per week. And then, other schools that used rapid antigen testing, 2 to 4 times per week. And so testing can occur on any day of the week, and again, would be designed and coordinated based on in-person, hybrid, and remote learning schedules. And, again, trying to decrease the disruption to educational time.
Okay, thanks, Jessica. Second question is also for you. Where will students and teachers be tested?
So all staff and students are eligible to participate in the school testing program. And again, the ICATT contractors can work with schools to create individual testing models, including logistics that work well for the school district. So depending on what's acceptable to the school, the vision would be that the contractor could either set up a convenient location, which classrooms could be brought to one at a time, or there are also push cart models where testing is taken to the classrooms. The contractors can also set up a communal testing location, located in a room at the school, like a lunchroom or an entry hallway, a gym. For older students, a lot of places have been testing them as they enter the building at the start of school each morning. And again, contractors can navigate from classroom to classroom or do that. So that really depends again on school need and district flow and preferences. But the I would say the primary emphasis has been put on flexibility and really to work with a model that works well for the district.
Okay, thanks, Jessica. Eliza, this next question is for you. Who administers the test?
So the test itself can be administered by the student or staff member who's swabbing their own nose. That's kind of the general practice for students in grade 2 and up who are able to. If you have a student or a staff member who can't self-swab due to a disability or due to age, there'll be trained staff members on site who can help that individual with swabbing.
Perfect, thank you. This next question is also for you, Eliza. What is the time flow of each testing event? And is there a recommended process for the scheduling of each testing group? And how do you prevent backup in lines and wasted time?
Yeah, so the swab itself takes a matter of seconds. It's just a few seconds in each nostril. So the kind of on the individual basis, it takes less than a minute by the time somebody approaches the station, takes their mask off, gets the swab, does both nostrils, and leaves, 30 seconds or so. But then the broader question of how does testing and sample collection fit into the school day is really kind of school to school. The testing vendors will work with school leadership to design a program that is as least disruptive as possible to the school day. So some schools like to do sample collection as students come into the door in the beginning of the day. Others have testing at mask breaks, or they have a cart that goes classroom to classroom. So they'll help schools figure out a system that's quickest and easiest and as least disruptive as possible. And the schedule throughout the week will be designed with hybrid learners, full-time learners in mind, so that everyone has an opportunity to get tested and it just fits into the flow. But on a typical day, it might be a couple hours, maybe a 9 to 12 window, for example, where testing is happening throughout the building.
Okay, great, thank you. It looks like we've got a few questions also brought in about on-site staffing and reporting. So Joe, this first question is for you. What additional personnel will each individual school need to provide on top of the contractor clinicians? And if the contractor will provide clinical resources, what additional responsibility is assumed by the schools?
Okay, thank you for that question. So for all the models, I'd first like to say, if a school has an existing strategy or model in place, our team and contractors will work to maintain that model if preferable. But ideally, the idea of using the ICATT resources is to help jumpstart schools to transition them from or that are to a stable long-term model, or to help schools that are struggling with implementing a model. So for all model schools are expected to for all models, schools will help provide input on the school specific testing strategy, including the logistics, the locations, the schedule. They will be expected to do communications with the school community. And again, Shaw has excellent resources available to help with this. So that would be communications with parents, students, or staff, or as well as government or news media. They'll be responsible for collecting parent or guardian consent, and providing a list of students who received consent for testing, and they would provide that to our contractor. And then also one of our metrics that we have to report out on is attendance metrics for the ICATT program. So there'll be an expectation that we get some attendance data on a regular basis. Depending on the model, either the school or the contractor will provide printed and distribute vouchers that confirms each student with parental consent will be able to receive a COVID test. They'll route students through the testing process They'll arrange for the storage or removal of biohazardous waste, and they'll also provide all the materials for or equipment for setup like tables and chairs for a testing area. And again, those activities will really be dependent on whether the school wants to participate in those activities or not, or they'd rather have our contractor do it. For all models, the contractor will provide all the testing supplies, the PPE, the office supplies. They'll test, they'll do the test sample collection. They will courier the samples from the school to the laboratory. They'll provide the medical personnel capable of conducting and aiding in the testing process. They'll do all the reporting back to schools, individuals, and to the public health agencies. So according to the CARES Act, they will also provide a program and account manager for each school site to oversee the testing activities. And they'll provide examples of communication and consent forms. And again, that's available through SHAW, which is an excellent resource. They have some great resources in this area. Over.
Okay, thank you, Joe. Jessica, this next question is to you. What are staff requirements for the ICATT program, and who provides check-in staff?
Sure. So, you know, as Joe mentioned, districts could prefer a more like a high tier, fully staffed model. From other states, we've heard that, you know, they would really like to use this opportunity to build the school health capacity within their own staff. And so I think it's really up to the district to identify, you know, what tier of service they would like from the vendor based on, you know, if they're trying to decrease workload within their district or increase and build staff capacity. But regardless, there are certain types of tasks that need to happen. And so, you know, those have been broken down in many ways to clinical staff, to staff that help and facilitate with the check-in process, and then other staff that really help with some of the logistics, you know, around escorting students to the specific testing locations, or, you know, with the testing cart, making sure that the testing area is maintained well. So, you know, regardless if it's on the clinical side, with clinical staff facilitating, you know, a self-swabbing process or assisting with the swabbing for younger children if they're unable to do so. Work for you, and then who would cover the various types of clinical check-in or logistical related responsibilities. Thanks.
Thank you, Jessica. This next question is also for you. How will schools collect consent from parents or guardians to enable students to be tested?
Sure. So a lot of districts have been gaining a lot of experience on the consenting process and really how to streamline that process. Many school districts have had success with things like Google Forms, and then also using, you know, paper-based materials, considering language, other things. The primary purpose, again, is to use what would work well in your district, but also in thinking about the streamlining process. Sometimes there is specific information that the vendor needs to generate the test requisition for the staff or student. And so many districts are now including that information, the personal details that are needed in the consent process, so that once they have consent, they also have all of the data needed to populate the test requisition on the vendor side. And then also as well, remembering to include things like all the appropriate HIPAA language so that information can be shared with third-party vendors, both for the test requisitions and ordering of the test, but also the reporting of the results. And then similarly with consent, you know, a lot of districts are now consenting students and staff to participate in the program. So there isn't a need for an ongoing consent, you know, versus consenting a staff or student for a one-time test.
Okay, great. Thank you. Joe, this next question is for you. How will schools and parents be notified of test results?
Okay, thank you. In the case of a positive test results, the parents and guardians who sign up for the web portal will be notified through the web portal. So test results, once they're available, you can log on and find them there. For parents and guardians who don't sign up to receive results through a web portal, they'll subsequently be contacted directly by the school. So the schools will get the results as well. And all parents and guardians will have an option to receive a secure email from the laboratory or request a phone call. So in addition, CDC is prepared to assist schools to work with local health departments to create messaging around the benefits of testing within schools. I saw that it's a question earlier. And there's also resources available, communications on the Shaw website, who is a non-government organization who's a partner of ours, similar to the Rockefeller Foundation, who's done a lot of work in this area, and they have some great resources available for messaging this type of information. Over.
Okay, thank you, Joe. I think we have some questions on funding and support as well. Joe, are there size limits to school districts for ICATT funding? If a large system is interested, which schools within the district will be selected for testing?
Okay, excellent question. So the ICATT program testing will be allocated across the country, and we hope to meet the needs of many states and school districts. We're going to be flexible in working with individual school districts. If a school district is on the larger or smaller side, we can figure out ways to either test the whole district or select specific schools. Initially, I wouldn't have that be a barrier. And then additional testing will be reassessed on a regular basis. And we anticipate this program to run through June into the beginning of July, and then transition to some of these larger programs. Again, our program is about a 20th the size of the ELC and the ET program. And so we will request an extension in June and July. But as of right now, that's when we're intending to offer the resources. So again, don't let size limit you at the from applying. We will try to structure our resources to meet your needs and the size of your district.
Okay, thank you, Joe. I think we're running a little short on time, but I think we do have time for at least one more question. So Jessica, this question is to you. Can ICATT funding be used for summer school or camp opening?
Sure. So I'll take a stab at this, and Joe, feel free to jump in. But, you know, I think ICATT's really trying to ensure a strong start for the fall. And so, you know, if states are interested in using districts to pilot something in the summer, like Joe said, there's funding available through the end of June with the possibility of an extension. So that would certainly fit in with the pilot design. Joe, anything else to add there?
Yeah, I would add that, you know, what we're offering here is really a Cadillac of services. And so we would encourage school systems to take advantage of that, to really explore different strategies for implementing testing in areas that are either underserved or difficult to get testing started in, and to apply them to different areas such as, you know, summer camps or schools or summer school, et cetera. Yeah, we'd encourage it. Thanks.
Okay, thank you both. And thank you to all of our attendees for submitting your questions and actively engaging in this webinar. If we've not answered your questions today, please reach out to the ICATT team by email at icat@hhs.gov. You will all be receiving a follow-up email with additional information and next steps. And we look forward to partnering with many of your schools and districts for the ICATT program. The webinar will now conclude.